My topic today was ecological public health, and with that topic I was looking at the food industry, at nutrition and diet-related disease. Ultimately, it is about health being based upon interrelationships, about the contact, about the complex interactions which underpin whether we have good health or bad health. So it's not simple about what drugs we take, what doctor we have, but the pattern of our lives in an evolutionary way. Thinking ecologically is about recognizing we're animals in an environment, but very special ones, and about the obligations we have to each other and to that environment to create health. One of the key challenges is understanding the difference between health and public health. That health, people think it's about individuals, and public health is about groups or it's about society. And it's very difficult for people to imagine what public health is, because generally they think of personal health and then they think that that's about medicine. So people don't have a very developed sense of the differences and of the importance. While in medicine is important, clearly they don't know about health being broader than that, the psychological and others. And again, even more difficult is to imagine what public health is, because it's about populations. And it's not about individuals, but it's about the context for individuals being healthy. So that's the difficulty of working in terms of a world which makes no discrimination. I think the solution is a difficult one to create, but it is about people working in public health having better stories to tell about what they do and about what public health is. Generally, people in public health see themselves as sort of technicians, or people who bring in new ideas and try to sell them as much as possible. So we should do this, we should do that, we should do the other. And they're all fine, but generally they're not popular stories. And what we've got to do is find a way of speaking to the public that we're not seen as killjoys, as people who are trying to stop doing things, but actually to align them with a much better story about a society where people are healthy and where we encourage the better health of our neighbours and of ourselves. And if we do these things, we'll have better lives. So it's a story about healthier lives and about progress, rather than about merely telling people to stop doing this or that. I found Geneva Health Forum to be a vibrant place to be, where one can meet people, one could take part in networks, which encourages people being creative and engaging with tough issues in an intellectual but also practical way. So it's been much better. I never thought it would be like this, so I'm not just surprised, I'm very pleased.